Hello, everyone. Carl Rosen here, Oculoplastics Neuro-Ophthalmology, Anchorage, Alaska at Ophthalmic Associates. Welcome back to Einstein's Eyes, our YouTube channel that John and I founded. Today, we have a really interesting topic to discuss, one that has recently come up in the media thanks to Justin Baldoni. It ends with us.
Yeah, he's not only the lead actor, he also directed it.
Right, so it's a really popular movie right now. And we're going to talk about something called a conjunctival nevus, which is essentially a pigmented spot that can appear on the surface of the eye. And I'm going to show it. And you can see that here's the nevus, this dark spot right here. So this is essentially a pigmented spot that can appear on the surface of the eye. What does it mean? Should we be concerned? We're going to cover all that and more. But before we dive in, I'm excited to introduce my partner, as I mentioned, for today's discussion, John.
Yeah, hi, I'm John Ditkoff. I'm an ophthalmologist in northern New Jersey. I specialize in cornea and the front of the eye, which is right up what we're going to be discussing today. Carl and I both trained at Albert Einstein in the Bronx many years ago. I know we look really young, but it was a long time ago, over 30 years ago.
Yeah.
And hence Einstein's Eyes. That's how we named our channel.
That's right.
So
That's right.
nice to see Carl. Carl's in Alaska. I'm in northern New Jersey, so we get to see each other when we do these wonderful videos.
That's right. It's good to see John too.
Before we dive into the technical, I just want to talk about one thing.
Okay.
So my wife and I went to see this movie a few weeks ago. It's an awesome movie, actually. Really well done. And I have to admit, I really didn't know who Justin Baldoni was before the movie. I immediately realized the guy's a hunk. I mean, I'm very happily married. I like women, but if I was to go that direction, he's the guy. I mean, he's a really good looking guy. He is really talented. I mean, he's amazing in this movie. And during the movie, my wife started to nudge me and said, "What's going on with his eye?" So after the movie, I did some research, and that's why we came up with this topic, because my wife wanted to know about what it was. I figured there's a lot of people out there that might have noticed what she noticed. So, Carl, take it away. Conjunctival nevus.
Right. So I just wanted to break down into a few. We're going to talk about 4 categories. We're going to talk about nevi, complexion-associated melanosis, which is typically observed around the limbus. The limbus is the circular part around the cornea, or the clear part of the eye. It's generally flat and non-cystic. Cystic nevi tend to be more benign, meaning they look like they have bubbles in them, and they really consist of about 50% of conjunctival lesions and are generally benign of the pigmented lesions. Usually, you can see them in childhood. They're very similar to nevi or spots on the skin. And there's a couple of categories of nevi. One is called a junctional, another is compound or subepithelial. And these are based on pathology, or the pathologist would categorize these based on biopsies. And that's not so terribly important. But usually the management for general nevi are you monitor it regularly, every few months with our slit lamp. That's a device that we have you put your chin on in the office, and we take pictures and we look for change. If it enlarges, if it increases in vascularity, that would prompt a further evaluation and potentially a biopsy. Now, you can certainly remove these, but why if it's not growing and if it's stable and chronic? The complexion-associated melanosis, or also known as CAM, tends to be known as racial melanosis. So in people with more melanin, darkly pigmented individuals. And like I said, it's observed around the limbus. If you examine the lesion, it appears flat and sometimes cystic, but oftentimes non-cystic. It can cover the conjunctiva extensively. It tends to increase with age, but it's not evil or troublesome like something called PAM, or primary acquired melanosis. Now, primary acquired melanosis you have to really watch more carefully. And it tends to be observed in fair-skinned people who are middle-aged or older. And on the slit lamp exam, we tend to see a flat, one-sided, not both sides, not both eyes, one eye, patchy, golden yellow to brown. And the examination of the cornea may also reveal a little pigment. As I mentioned, it's unilateral. The age, when it first presents, is not really that important. If it's discovered more at a younger age, we think of it more as a nevus, but the diagnosis and the examination really will dictate going forward how you treat this. Now, nevi usually present with cysts and are well circumscribed. They are often thicker, the nevi, than PAM, but PAM, on the other hand, tends to be a little bit more diffuse. It appears like you have a thin dusting of pigment and is not usually well circumscribed. Now, PAM with atypia, you can identify with a biopsy, and that can present to malignant melanoma. Now, PAM with no atypia, if you biopsy and the pathologist says there's no atypia or cellular changes that resemble more of a malignancy, it really has no risk or very little risk, and we don't get too excited about that. But this is determined by histology or biopsy under the microscope. What do we do? Well, if there's any nodularity, thickening, vascularity, we'd like to do a full excisional resection. And there's something called a no-touch, particularly if you think it's malignant melanoma. You don't want to spread the tumor or the lesion, so we tend to do something called a no-touch excision and cryotherapy with an ice ball around it and alcohol as well. Everybody's got a little different technique, but generally that's how ophthalmologists, oculoplastics, and cornea specialists deal with it. Prognosis is really important, and melanomas, primary melanomas, have a bad prognosis. They can have sentinel nodes, or they can spread to the lymph nodes, and then we get a head and neck exam from an ear, nose, and throat doctor, and we get an oncologist involved. Predictive factors for poor survival include older age, male gender. If you're not white and you have a melanoma, it's not as good. And tumors with nodularity or ulceration. Recurrences can be common and can be 45% at 5 years and 59% in 10 years. That's some of the data. Melanoma-related deaths are 5 to 17% at 5 years, 9 to 35% at 10 years. And again, it depends on the cellular type, the amount of atypia, or the amount of aggressiveness, and that will be determined by the pathologist. I should say that on occasion, people do use something called mitomycin as a topical drug to use after the melanoma has been excised, and it's a treatment adjuvant. But like I said, double freeze, slow thaw, cryotherapy is the technique we use at the margins of the excision. If you're interested, Carol Shields and Jerry Shields from Wills Eye Hospital are the gold standard in this area for conjunctival lesions. And they have a bunch of great papers. Survey of Ophthalmology in 2004 has a really interesting article. There's a lot of good stuff in the Eye Wiki at the American Academy of Ophthalmology, if you're interested. And John, anything you'd like to add to this?
Yes, so Carl, that was an awesome summary. I mean, I learned a lot of things. I guess I would start out with a few, just, anecdotal, based on my experience. I've been doing this for 30 years. So just like this picture we showed of this famous actor, the majority of people that come in my office concerned about pigment on the white part of their eye, as Carl said, these are nevi. We call them freckles. They're not any different than the freckles in your skin for most people. And in fact, most people are born with them, or they get it early in life. So the majority of my patients that come in with this, I reassure them, I take pictures, I tell them to keep an eye on it, and I watch it. And the majority of people, the overwhelming majority of people, it doesn't change, just like this famous actor. Then you talk about what Carl was talking about, which is these other subtypes. So I do have a significant population of Black patients that have a lot of pigment, like Carl mentioned. And those people are generally not concerned. It's more racial pigmentation. They're not even nevi or freckles. It's just the same pigmentation from their skin that happens to be in the white part of the eye. And then you have fair-skinned people where our antenna goes up because we see pigment. And as Carl said, if it's only in one eye and it's kind of spreading, that's when we get concerned. And that's when I'm much more likely to biopsy them. And that means go and take a piece of it and see what's going on. And then when we send that to a lab, as Carl mentioned, if the cells are very regular and they're just pigmented cells, the prognosis is actually very good. It basically is a freckle. Maybe it came on later in life. Maybe it is a little bit diffuse, but those are people we don't worry about. The people we worry about, like Carl mentioned, is the people with atypia, which means the cells are not uniform. They're different cells. Those are people that have a high risk of progression to melanoma, and that's when you want to remove all of it and do adjunctive therapy, which is not my expertise, but like Carl mentioned, there's some really good experts in the country. There's Paul Finger in Manhattan. There's a bunch of really good people, but Shields, that's the gold standard. And then the only other thing I would mention about melanoma is the survival rates that Carl mentioned are accurate, except that melanoma, fortunately, the treatment has really improved in the last 5 to 10 years. There's a treatment called immunotherapy. So I think those numbers are going to look better in the future. It's still a scary disease because it can spread to the rest of your body, but the new treatments have really been encouraging. That's my summary. I mean, I think Carl did a great job.
Yeah. So thanks, John. And you're right. The data that I am relaying and that I've reviewed is a bit older. There is immunotherapy, which is certainly much better. We should know that there are consequences to the immunotherapy itself, and that needs to be discussed with the oncologist. But in conclusion, so just to wrap things up, most pigmented lesions on the eye are nothing to worry about, but they do need to be monitored. If you have a conjunctival nevus, like the actor Justin Baldoni, make sure you get it checked by your ophthalmologist. We hope today's discussion helped clarify things for you. It's a very interesting topic, a very important topic. If you have any questions, please leave them in the comments. But thanks so much for joining today. Please be sure to subscribe, and we will see you on the next one. We had a blast. Thanks, John.
Bye-bye.